Okay, great. I see we have a few people who have joined us already. We get started in just about 4 minutes. Welcome, folks who are trickling into the meeting. We're going to get started in a couple of minutes. Hello to everyone who's joining in. We're going to start in about a minute. Just requesting you to keep your cameras off and your microphones on mute, please. Thank you. Yeah, hi everyone. Just that I know some folks are trying to get the AI note takers into this meeting. We are recording the meeting and you will receive the recording as well as some key highlights from the meeting and accompanying resources. So we are not allowing AI note takers, if that's okay. But we will make sure that the recording is made available to everyone. Okay, folks, we're on time, so we're going to get started. Welcome, everyone. Thank you for joining us for this very exciting information webinar on market-based approaches for menstrual product access. I'm Arundhati, and I'm representing the Global Menstrual Collective, which is a global advocacy platform that's pushing for advocacy, action, as well as investments in menstrual health. So we welcome you all. We're delighted to be doing this information webinar in collaboration with the Reproductive Health Supplies Coalition, who are leading some very exciting work on market-based approaches. So one of the big reasons as to why RHSC and the GMC thought that this would be a good webinar to do is that the term market-based approach is increasingly being used. You may have seen articles and the term itself popping up on LinkedIn, as well as in conversations with organizations, donors, etc. But it's a large term and it's not always well understood. So we thought it would be good to do a bit of an information webinar where we're deep diving to unpack what a market-based approach is, as well as to highlight some fantastic opportunities that are emerging for organizations across the world to engage with some of the work that's ongoing in this particular area. So today's webinar is structured in a way that we're going to have a short presentation by one of our colleagues, and we're going to move into a panel discussion where we'll get some more insights into how the market-based approach is being actualized globally. With this, I want to invite my colleague from RHSC, Sarah Webb, for her opening remarks. Sarah, before you come on board, I'm going to actually quickly request everyone to please keep your microphones on mute, turn your cameras off, because we will have colleagues joining us from areas where bandwidth is an issue. We will have a space for Q&A in between the webinar as well as towards the end. So please, in the meantime, put your questions and comments in the chat box. Sarah, over to you for your opening remarks.
Thank you so much, Arundhati. Good morning, good afternoon, and good evening to everybody who is joining. We are very excited to have you here today. And as Arundhati said, our hope is really to help familiarize everybody with the concept of market-based approaches. For those who don't know me, I'm Sarah Webb. I'm a Senior Technical Officer at the Reproductive Health Supplies Coalition, where I have the incredible privilege of working very closely with our colleagues in the Menstrual Health Supplies workstream. If you aren't familiar with RHSC, we are a member-based coalition. So we bring together different organizations and individuals and folks in different capacities to really elevate issues, address barriers or challenges that people are having in accessing reproductive health supplies, and then bring people together through collective action to problem solve around those. And one of the groups that we lead and that we bring people together in is the Menstrual Health Supplies workstream. There are several different members and colleagues of ours from that workstream on the call today, each of whom will provide kind of a different perspective on market-based approaches. And before we get into those presentations, we wanted to provide a little bit of context around why we decided to dive into the market-based approaches for menstrual health. RHSC, as you might have kind of gathered from our name, is very focused on the supplies side of things. So looking at how people access different reproductive health supplies where they are kind of in the communities that they live in. And one of the challenges that we've noticed and that we've talked about within the menstrual health supplies workstream is an access challenge to menstrual health products, in part because they are not affordable or they are not made available in these different communities. And so one of the things that our workstream members was talking about was how we could better leverage the market. So how we could use the market to ensure that people had access to products, not because there is a desire to create more profit, not because there is a desire to turn this into a for-profit business model necessarily, but because of a recognition that because end users are typically the ones buying menstrual products, leveraging the market presents an opportunity. And that opportunity is that by using the market, we reduce reliance on donors, we reduce reliance on health systems kind of outside of the countries that we're working in, and we can use the market to spark things like innovation, new product development, and cost effectiveness. And so this conversation really originated out of a desire to leverage the market in a way that would work for end users, and recognizing that donation-based approaches alone will just never be able to meet the demand that we have globally. And so over the past several years, people within the menstrual health supplies workstream, as well as some of our different groups at RHSC, have been coming together to brainstorm what a market-based approach for menstrual health might entail, how we might be able to use the market in a way that is not only sustainable, but also equitable, and how we might engage stakeholders across the value chain. So really looking at everybody from product innovation and development through to government stakeholders, NGOs, and advocates, and then all the way to the end user to make sure that the product not only meets their needs, but is affordable in a way that is sustainable and permanent. And so with that, Arundhati, I will hand it back to you. We have several different colleagues on the line today who will get a little bit more into what that will look like and how we suggest going about doing that. And we are excited to hear from them. So back to you, Arundhati. Thank you.
Great, thanks, Sarah. I think that, just some couple of points that I want to reiterate and especially emphasize certain terms that when we're looking at the market-based approach, we do have certain values and principles that are central: sustainability, equitable access, focus on choice, affordability, but also on quality. And I think that our speakers today are going to be touching on several of these issues during the conversation. So that's great. Thank you for highlighting these points. More people have joined us. It's great to see the room filling up. Just a quick logistics, please keep your cameras off and your microphones on mute. Introduce yourself in the chat pod and chat box. And also place your questions that you have for our speakers in the chat box. We'll make sure we get to those questions. And lastly, some of you are trying to have your AI note takers. We're not letting those in. We are recording this session and we'll be sharing the recording with you in the next 2 weeks along with useful resources. Okay, with that, we're going to open it up to our first speaker, who is Sonia, who is with the Sanitation and Hygiene Fund, and she's also representing the Reproductive Health Supplies Coalition's MH workstream on some of the interesting and exciting work that they're doing on really unpacking the market-based approach. So Sonia, over to you, and let me know if you're having any difficulty presenting.
Pleasure to be here and to be able to have this discussion. I just want to confirm if you can see my screen here.
It's coming up, but it's not up. Yes, it's come up. It's visible.
Okay, fantastic. So thanks so much for the introduction. As Sarah also mentioned, I'm speaking today on behalf of the Reproductive Health Supplies Coalition workstream. It's a collaboration between the MDOG and the Menstrual Health Supplies work streams working together. And within us, a small subgroup has spent some time over the past months working on a theory of change around the market-based approach to menstrual health. Now, I just want to start with a caveat that is, of course, when we think about menstrual health and the holistic nature of menstrual health, that is absolutely the approach. However, within the context of today's conversation, we're really going to be looking at market-based approaches to menstrual products and supplies, rather than the broader overarching look of access to menstrual health services. So equally important, but just this is the focus for today's discussion. So I think where we want to start is really by saying, if we look at the menstrual health market, what we know is that it's really falling drastically short of meeting the needs of people who menstruate. Now, if we look at the population, we have over 1.7 billion menstruators in low and middle income countries. And that number is rapidly growing, expected to grow by 9% in 2035. And yet we have an estimated 613 million women, girls, and others who menstruate who are using non-purpose made products. This could be anything from toilet paper to rags, or really any substitute that they use to manage their menstruation. And yet what we know is that the menstrual health market is actually driven by consumers. And so I'll try to make sure that the language we're using in today's discussion is friendly to all, because we know that there are many who are interested in market-based approaches, but not having that real background or expertise yet. So when we talk about market barriers or structural barriers to market access, what are we talking about? Well, the menstrual health market in this context is looking at access to supplies, menstrual product supplies. And so some of those barriers are things like affordability. What we know is that the commercial cost of disposable pads or any product that you're finding in a widespread way on the market is actually very high for many consumers. And so that is a barrier to access. We also see that there's a real limitation of the availability in markets to menstrual product innovations. And so when we talk about innovations, we're thinking about biodegradable products, reusable menstrual products, and these new products that we're starting to see becoming increasingly available with a high market interest in other countries and in other contexts, but that are not yet available on the markets in low and middle income countries, in spite of established interest. Other market barriers are really around information. So this is really what we would call information asymmetry. There is a lack of consumer awareness about different categories of menstrual products, and often a lack of demand that stems not from a lack of interest, but rather from a lack of information. Another form of market barrier that we see often in low and middle income countries relate to the regulatory environment. And what we mean by that is maybe the taxation environment. So what are the taxes that are being placed on menstrual products for end consumers? What are the taxes on the raw materials and the machinery that are used in the manufacturing? And other regulatory barriers like a lack of menstrual product standards that enable us to provide certification and consumer assurance around product quality. And this also contributes to barriers around high production costs. So when raw materials are not available locally, or if they're highly taxed upon import, that can lead to high production costs, which then contributes to another market barrier, which is around affordability. And so these are several examples of barriers at the market level that are prohibiting access at a wide scale for consumers to have the ability to purchase a range of different menstrual products that are safe and affordable and quality in the places where they need to access them at the times that they need to purchase them. And so taking a step back and really looking at the menstrual health market, what we know is that there is an enormous potential for this market. We know that most consumers actually, access menstrual products through markets, and yet the market is failing to deliver the products that people need, where they need them, and at the prices that they need them in many countries around the world, and most particularly in low and middle income countries. And so what we're discussing today, and when we talk about market-based approaches to menstrual health, what we're really talking about is working towards a goal of having a well-functioning and competitive menstrual health market that can sustainably and equitably provide access to safe, quality, and affordable menstrual products for all menstruators. And so that is the goal. So when we talk about or market-based approaches to menstrual health, what are we talking about? Well, specifically, this can be called a market-based approach. It could be called market building, market shaping. There's different language and terminology that is used, but when you boil it down, it's really looking at the interventions that market actors use in relation to supply and demand of a product or a supply or a service to support those actors in the market to create this well-functioning competitive market. And the reason why we are interested in using market-based approaches is because they have the potential to really increase access for all menstruators across the life course to the products they need when and where they need them. And in doing so, we are able to really expand the access or the size of the population that can access these products. And again, we're talking about accessing them through markets and from that perspective of sustainability and the perspective of equity. And so what we would like to dive into is, highlighting some of the reasons why market-based approaches are a tried and true approach to increasing access to essential commodities in other markets, and specifically, how does that apply when we talk about the menstrual health market? I think first and foremost, a market-based approach is aligned with how women and girls and those who purchase menstrual products actually access them in the real world. The majority of the population does not receive a menstrual product for free. It is not a product that is given as a handout. And while there are programs that do that, they certainly don't meet a significant portion of the population. The majority are buying products through markets. It's a known and established behavior. And the question and the challenge that we have is, can we increase access to all and to a range of products, again, when and where menstruators need them? But this behavior of purchasing through the market is already the norm behavior. Now, another key factor about market-based approaches is that they really have this potential to address market failures and market barriers. And so those are some of the bullet points that we just spoke about on the previous slide. Things like high production costs and regulatory constraints and affordability. And markets are really known to provide the most efficient allocation of resources. And that is why what we see in a mature market is that there is high competition. Competition drives prices down. And through the growth and the efficiency of the markets, we're actually able to reach the masses at the most affordable cost. And so leveraging a market-based approach is building on those very principles of markets and market efficiency. Now, another reason why market-based approaches create such a compelling opportunity for the menstrual health market is collectively, we know that there is no one product fits all, not within a menstrual period or a menstrual cycle, and not across the life course. Everyone has different needs, different preferences, different purchasing power. And so product choice is really a fundamental when it comes to menstrual health and menstrual equity. And markets provide the opportunity to bring those who menstruate and the products that they need and that range of products, so that we're not just looking at current markets where we see them dominated by single-use pads, and we see markets where we have a range of brands and different performing types of products, but they're all really falling within that category of single-use products. Markets have the potential to bring a range of products and to ensure that through market regulation, that those products are safe, and that then consumers are empowered to use their consumer purchasing power to make informed choice. Now, another aspect is around innovation and competition. In reality, a competitive market is actually the best thing for consumers. It brings in new products, it pushes companies to innovate, it enables costs to become more competitive, which forces consumers or manufacturers to drive pricing to meet the needs of a wide range of consumers. And so when you have a highly competitive market, it actually really enhances the consumer's ability to access product range and product affordability, and to really focus on that aspect of innovation coming into the market. As Arundhati has already said, markets have an opportunity to provide a more financially sustainable and long-term approach to the question of access when it comes to menstrual products. Programs that provide free distribution have an important role to play, and we'll speak more about that in a moment. But the donor dependence that comes with a market that is entirely dependent on free distribution of products is not a sustainable market in the long term. And yet, by working through a market-based approach, we really have the opportunity to provide a more sustainable way of bringing products to market for consumers. Now, markets inherently tend to be quite resilient, and that is especially true of mature and competitive markets. And while we don't see many highly mature menstrual health markets in low and middle income countries, we see the majority of these markets are dependent on a single category of product or several market leaders who are dominating the product offering available on the market. What we see is that as markets become more competitive and more robust, that they're actually more resilient to all kinds of disruptions. And those could be socioeconomic, so a change in inflation or currency, could be environmental, so that could be linked to climate change, or even geopolitical. And so looking at a market-based approach, we all are living in this world right now where we see how things are turned upside down by the collapse of USAID and changes in the donor landscape. A market-based approach will really enhance resilience in times like this. And lastly, as I mentioned a moment ago, there really is a role for targeted subsidies and free distribution programs within a market-based approach. So they're not mutually exclusive. We do recognize that there have to be some level of programmatic interventions in a market-based approach, and we see that in other sectors, including the reproductive health supplies sector. And that's to make sure that we can reach highly vulnerable populations and those who are simply unable to access products through markets, even if those products were there for them. So on a broad level, what we see is that there are a wide range of reasons as to why market-based approaches can really help to accelerate and catalyze access to menstrual products, not only when it comes to product choice, but also when it comes to safety and affordability. And so this is the let's say an approach that Reproductive Health Supplies Coalition has really seen that there is a power to leverage. And so on that note, I think it's important that we look at who are the market actors when we talk about market-based approaches. So what we know is that to have an effective market-based approach, it requires the active participation of a range of actors. Now, we have consumers, so those are both buyers and users. And we have to highlight that there are buyers that are not the actual menstruators themselves, but there are many who access menstrual products through someone else who's bought it for them in the market. Now, two other key players or key market actor groups are the supply side actors and the demand side actors. So when we talk about the supply side actors, we're really talking about the production and the value chain. So looking at who are the raw material suppliers, who are producing the products, who are distributing and retailing the products, what is the role of quality and quality control along that entire supply side value chain. And if we want to see products reaching the market at an affordable price, there actually have to be these synergies and efficiencies in place across the entire supply side value chain. Now, when we look at the demand side actors, now here we're talking about the brand owners. So this could be the manufacturers who are actually producing the product, but this could also be the retailers and the distributors who are bringing the products to market. This is the sales and marketing channels that actually create the demand, so doing that demand creation work and putting the product on the shelves itself. We also see the role there of market researchers and even media agencies and consumer advocacy and consumer protection groups who are making sure that the products that are reaching the market are quality and fit for purpose. And parallel to all of this, or let's say running across all of this, is the enabling environment actors. And what is clear is that manufacturers alone, consumers alone, cannot drive and shape the market. And so when we really talk about market shaping and market building for a market-based approach and all of the interventions that are necessary, we have to consider who those other enabling environment actors are, because they play a key role. So we have funders, so that is anyone on the donor side, the investor side, or even financial institutions. The players on both sides need to have access to the funding and financing they need in order to play their role in the market. There's also what we call ecosystem facilitators or ecosystem enablers. And essentially, these are all of those other technical stakeholders who are playing a role in shaping and guiding the market. They could be doing work around advocacy. They could be doing work around demand creation. They could be doing work around consumer information. But they're playing a very important role in enabling the market to be effective and successful. So some of the players we see there would be INGOs and NGOs, technical assistance providers, so those who are providing some type of consultancy services, and then the key role of the bilateral, multilateral agencies and academia or research institutions who are providing really fundamental information about how the markets are operating. And then, of course, there's a very important role of government. Now, in other sectors, government has a stronger role to play. In the menstrual health market, what we see is that the government really has a role to play when it comes to policymaking and regulation, and also around the taxation and the burden of tax on both the production of menstrual products and then the cost of menstrual products to the end consumer. So government has a role to play in all of this, as well as being a key information provider. And what we see in some contexts is that government is actually even a direct procurer and provider of menstrual products. And that would be more in the programmatic interventions that we see that happen in parallel and in a supportive way to a market-based intervention. And then lastly, we have the role of media and policy influencers and regulators. So that could be the WHO or other overarching international organizations. But what we know is that it's really only by working together as an ecosystem of actors that we can actually work towards creating a market that is well-functioning, that is sustainable, that is competitive, and that can equitably bring menstrual health products and those necessary supplies to the markets, both globally, but in particular in the LMIC context. So I think on that note, what I would like to share is that On behalf of RHSC and the work stream that has been working on developing all of this, we will soon be publishing a brief and the theory of change that goes along with this work that we've just shared today. I want to thank any of you who are on the call, who are listening to this, who have participated in the working sessions that we've had along the way to solicit input and contribution to the theory of change as we've been developing it as a work stream. It has been a very collaborative and supportive process. And the aim here by producing these materials is to really make sure that as a group of market actors, as a group of stakeholders, that we really have a common understanding of what we're talking about and what our aims are when we're talking about market-based approaches to menstrual health, and that we can advocate for adopting and implementing market-based approaches across this wide range of market actors whose role is necessary and critical to be able to make sure that access is really increased at a systemic level. So on that note, I think I'll hand back over to Arundhati and we'll proceed with the panel.
Great, thanks so much, Sonia. This was a fantastic overview and quite a lot to take in. So I encourage everyone, please sit with us, ask any questions on the chat box. We will hold our questions for after the panel. We're going to proceed to that. And actually the panel segues very well, Sonia, from what you presented, because we're going to allude to and speak to the enabling environment and how their work is contributing towards that. So we're very excited to have with us Martin Smith, who is the director of RHSC, Adrian Dongas, who is the MH market specialist at the Sanitation and Hygiene Fund, Diana Nelson from Days for Girls, but she's also the co-chair of RHSC's menstrual health workstream. So we're delighted to have the three of you with us. As I'm going to spotlight each of you, I'm going to actually kind of dig in with our questions, given that we have just about half an hour to go. So Martin, I'm going to start with you, given that RHSC is really looking at bringing so many stakeholders together to unpacking and to advancing market-based approaches for menstrual health. But this is also not a new area for RHSC. You've leveraged a market-based approach to other reproductive and sexual health issues that RHSC has worked on. So talk us through a little bit about what's RHSC's thinking behind this, what's your role, and what are some of the key lessons that you've learned from RHSC's work in other areas?
Thanks so much, Arundhati, and to Sonia and all the colleagues that have worked on the fantastic framework that was presented. So as you say, Arundhati, RHSC's at our core really is a belief that market-based approaches will ensure better access to a wide range of quality, affordable SRH products, and that goes for the four main reproductive health areas that we focus on: menstrual health supplies, of course, safe abortion supplies, contraception, and maternal health. We leverage a variety of market-based approaches to ensure that long-term sustainable access, and we look to build systems and access that really does remain resilient in the face of shocks. And we can see several shocks to our reproductive health supplies ecosystem just in the last 5 years, whether it be pandemics or significant reductions in donor funding. We aim to be resilient through all of that. So turning to our menstrual health supplies work stream, Diana, Adrian, Sonia, Tanya Mahajan, and many others are sort of great dynamic members of this group. Please do join the group. If you can, colleagues who are on the line who are yet to engage with us. But we focus on bringing those stakeholders together from across that value chain, really, to accelerate access to the range of menstrual health products. And each of those work stream priorities, quite frankly, are really tangible and clear and speak to this market-based approach that we're dealing with today. So firstly, accelerating access to and use of data on menstrual health products to inform decision making. And it was great to see Sonia take us through the LEAP report that we produced just about a year ago, a very in-depth section dealing with menstrual health as well as the other areas. Some staggering statistics in there, to be honest with you. $28.8 billion spent in lower and middle income countries on menstrual health products. We have a very, very good analysis also on the annualized cost of single-use and reusable products, as well as some projections through to 2035 that I think everyone on the line will find important. That's the data part. Then, of course, we're building the case for integration of menstrual health, both with the wash sector and the broader reproductive health sector, a second area. A third is really advocating for the development of menstrual product standards, and that's being done in collaboration with the International Organization for Standardization's Technical Committee 338. There are a lot of technical committees. There's a specific technical committee dealing with standards, quality standards in our area. And our HSC and a whole range of partners have obviously played an important role in bringing that to the fore. Fourthly, accelerating access to evidence and the knowledge base to really give you, our community, the advocacy messages you need to advocate for those menstrual health market-based approaches. So please join our work stream. Now, I will just take one more minute, Arundhati, if I can, just on the second part of your question with regard to what can we learn from other parts of the sort of reproductive health supplies landscape? Well, certainly within the realm of contraception and family planning, there's been this very effective way of using donor investments specifically to seed the market for the introduction for new products, but then to shift to integrate products into those health systems for market-based approaches, while, as Sonia says, still leaving room for this targeted subsidy and for this free distribution. That would be one area where I would highlight. A second is really, though, that the importance of choice. Again, contraception and family planning have done an excellent job in emphasizing the need to ensure that users, that clients have a range of options to meet their specific needs. And I think we very much take that on board in our work in menstrual health supplies. But just two unique parts about our menstrual health supplies community to highlight. I think we've got a unique opportunity with the market-based approaches that Sonia was taking us through to build that sustainable system from the beginning without maybe some of the fragility and fault lines that have been shown to be very much there in our broader reproductive health community in the last 3 months, leveraging those market dynamics to build that sustainable base that we can build from. And in fact, the agility, the adaptability, the creativity that we continue to see since Menstrual Health Supplies and our work stream was founded some 7 years ago, driven by our members, I think continues to inspire us. And yes, this market-based approach, but as Sarah pointed out, not driving towards profit per se, but really ensuring that systems are resilient and can really meet the needs of our users in a completely sustainable way. So, Arundhati, thanks for the opportunity to talk a bit, and back to you.
Thanks, Martin. I think when we open up for questions, I also want to hear some of your thoughts around, when we talk about resilience, we also talk about climate change and what that means for reproductive health supplies and menstrual health supplies, and also in an increasingly unstable environment of war and conflict and other humanitarian contexts. So we'll circle back and hear some of your reflections on that. Adrian, we're moving to you now, and it's really interesting to see that the Sanitation and Hygiene Fund has a specific focus on enabling markets and a market-based approach for sanitation and for menstrual health. So tell us more about how SHF is really catalyzing action in this area. And if you have any specific examples to share with us about what you're doing and how you're doing it. Over to you.
Thank you, Arundhati, and it's great to see so many people showing up. Thanks for my colleagues who've really set the stage in talking about the subject. Apologies for being a bit more casual than usual. My luggage is stuck in an airplane. I just arrived in Nairobi, so yeah, that's the reason why I look like a lumberjack tonight. In terms of the Sanitation and Hygiene Fund, indeed, we look at a couple of different areas. I think the essence of what we want to achieve is quite simple. We want to put people in a position where they can get access to essential products and services close to where they live. And I work for the UN, but we're not great at doing that. The markets are much more successful, whether I need a bathroom for my house, food to cook within the kitchen, get a smartphone, and menstrual products are no different, or at least they should not be any different. Within SHF, all our work around menstrual health markets is grouped together under an initiative called Capital M. So if you see different communications going around from this initiative that's you've never heard of before, that's the reason why. Because we think that we need to take menstruation from the bathroom to the boardroom. It is both a matter of dignity to address MH from a systems lens, but it's also an opportunity that Martin highlighted really well. We're talking about a $28 billion market today in LMICs, while more than a third of people don't have access. And let's get things straight. I think for us, it's incredibly important that the most vulnerable people, whether that's from conflict or natural disaster, get access to products for free when they need to. If you're fleeing your house and your home, you need that. But we need more than $9 billion a year if we were just to buy these products for free every year. That money isn't there. So that's not going to be the solution. The solution that we're looking for is to put a range of products on the shelves that are safe to use, that are of quality, and let girls and women and their husbands, their fathers, choose from the shelf what they want to buy. That is real empowerment. And I think that that's the scenario that we need to go to. But that also means taking a step back and trying to understand, well, what are all these facets in this market and how does that work, right? Because the real inequity, as Sonia highlighted, is that we've seen massive innovation in this space, but the most affordable products on the market today are not available to the lowest income user. And that's the problem that we need to fix. So what we look at as the Sanitation and Hygiene Fund, we really look at three pillars. We look at the enabling environment. So all the rules, the regulations, the policies that determine how this market works. We look at the private sector and see where do they need help? How can we help them develop the right kind of models that can bring these products available across countries, across markets at scale? We need system change. But even if you succeed in doing those two things, it is incredibly hard to make a successful product with a successful strategy work when you don't have the money to do so, right? And that's the last bucket that we look at. That's creating access to finance. And there's a role here for public funders like ourselves, for philanthropic foundations, to make the investments in building in the components of the market that are not directly related to building an individual enterprise, and then working with private finance and development finance to make those models scale and grow. So let me give you a few examples of what that looks like, right? So as Sonia mentioned very clearly, it's important that we understand how the market works, right? So we partner closely with RHSC on a range of different topics, and I think LEAP is a great example of that. As the fund, we've developed a menstrual health market maturity assessment tool that we're now trialing in Kenya. And the main idea behind this is, let's look at all aspects of the market and do an analysis so that all stakeholders involved can look at the market in the same way. And then we can start identifying where are the gaps, where are the problems, and is that a role for me to fill that gap, or should I maybe go knocking on the door of a ministry or a national standards body to say, hey, it's time for you to take some action? So looking at the market in the same way is essential. And then there are different kinds of policy drivers, right? And I think it's important to note that we have phenomenal organizations here on the call who have decades of experience in doing policy, advocacy, lobbying. And I would encourage you to expand that work to include key policy drivers. And I'll name two. Standards, essential, absolutely essential. It's a big barrier to market entry. And I know that Diana will be talking about that in a minute. But the other ones are taxes. I just came back from a trip in India where the value added tax, or the GST as it's called there, is 0% on single-use pads. But if you make period underwear, reusable pads, or menstrual cups, you incur 18% VAT. Companies that work in different countries in sub-Saharan Africa can incur 80 to 100% in import duties, while sanitary pads are the duty-free. So if we want to make these product innovations available, it's not necessarily that the governance made a hard choice to say, oh, we're going to price these higher. No, these are new innovations that have come up that haven't found a home yet in their systems. So we chose very specifically to be a UN fund so that we can get a seat at the table, work with governments to show them, right, that your system is designed like this today, but there's an opportunity to do that better. And we need to recognize that governments need income streams. But what we at least can ask of them is to tax menstrual products in the category that they are, an essential item, and ideally a low to no tax bracket. That's one example of how to approach that. When it comes to supporting private sector, I think what's really important here is that we have also on this call, companies that have done phenomenal work. They really understand their user. And I'm sure there are many who have a phenomenal product. But because of the way that this context has been, especially in sub-Saharan Africa, most of the money could be made selling your product to NGOs and governments who hand out your product for free. But selling to an end user is a different space where limited to no investors were backing you up, where there was very limited grant money to help you explore and figure that out. And we're about to launch an SME support program in 2025 in East Africa, 2026 in West Africa, where we're looking exactly at this, connecting private sector with enterprises who've done this, already done and achieved what you want to do. Look at the learnings from mobile wallets, cell phone penetration, pay-as-you-go solar, family planning commodities, talcum powder, baby nutrition. We've done this for so many products already. So let's figure out how that market works. How do you structure your pricing? How do you work with wholesalers? And how do you, and this is going to be, I think, the biggest question mark for us. How can we do cost-effective marketing strategy that will let people know that your product category exists and drives them to take out their wallet and buy that product off the shelf? And those are some of the questions that we want to give you not only technical expertise, but some grants with to play that out. And for us, we are the first funder maybe stepping into that. I think RHSC has been the global platform where that conversation has been shaped over the last 5 years. And we also need to talk to more funders to bring them into the fold, because we have an opportunity to make a structural change in this market that's going to change the way every woman, every girl, and everyone in their lives will be able to access a product moving forward. But then we get all of you there. And then what? If you don't get a loan, and I've had many conversations with people who are saying, I'm producing a great menstrual cup or a reusable pad, but I need fabric from China, or my manufacturer for my cup is in India. Well, you need to buy an entire container, move it from India to Mombasa, pay the clearance fees, and then you sit it in your warehouse for 3-4 months, and you only see the money once you've sold everything. Now, that's a lot of money. And most companies in the value chain, well, you need to provide a loan, you need to cover that cost. But if you go to the bank here, you're going to spend what, 20, 25% in interest? Certain countries have been at 30, 35%. So how can we use some of the grant funding that certain donors and philanthropic funders have available to reduce the risk? How can we make an interest for a social enterprise that is doing a great job, or a regular enterprise, but maybe not pay 20%, but maybe 8% in interest? How can we incentivize investors to invest into menstrual product companies and their partners in the supply chain earlier? Because ultimately, the real issue is that the users we're targeting don't have enough resources. They don't have enough financial resources to buy all the essential items they need. It's not just menstrual products they're thinking about. They're thinking about food and medication, school fees, and a roof over their head. And all of those things are important to them. And that means that we can't drive the cost up indefinitely. And we could sit back and we could wait and say, in 15 years, this population will be rich enough to buy that. But I think we think that is unacceptable. So we have real opportunities to make that change. And there's a huge opportunity for all of you on the call to contribute to that. And I think we're just playing a small role in providing the right information, dealing with some of the structural market barriers that as an enterprise, you can't spend your time and your money on, and hopefully get you to develop that model so that you become the next household brand that everyone in the country and in the region that you work in will have on the shelf and will know about. That's the goal. Over to you, Arundhati.
Great, thanks, Adrian. We have a question that may be good for you to reflect on towards the end of the webinar is, do you have an example of a country that has a well-functioning menstrual product market? And don't answer it right now. Hold on. If you want to allude to this a little in the chat box, please do. But maybe just to put a spin on it, do you know of an example from an LMIC that does this? So keen to hear your thoughts. Diana, picking up from a key point that Adrian raised, which is that what is the role of the International Standards Organization, and I think also critically national in supporting and enabling a market-based approach? I think throughout this conversation, from Sarah to Sonia, Martin, Adrian, all talked about the importance of having quality products of choice that are affordable. And all these three things are very deeply linked. So share a little bit about what's happening with ISO, as well as how do you work with your NSPs, national standards bodies? Over to
this is such a great discussion. I hope everyone is I'm so engaged in it. I'm like, okay, it's my turn. But yeah, Adrian just in when he was talking about, he said, how do you know a product has integrity? And this is where the ISO comes in. This to me is one of the key anchors of helping create this market, because they are determining what is the standard, what is safe, what is effective, and what is reliable by the standard being published. So one of the things, the ISO has several roles to play in this. One is they know that this will become the trusted standard for the industry. And because of that, they follow very strict rules in how it is developed. And one of the responsibilities they have is to ensure that there's key stakeholders are at that table in the development. So we have gynecologists, we have textiles, we have chemists, we have consumers, manufacturers, and the national standards bureaus are there to ensure that everyone has a say in this development, so that when it's published, everyone knows it went through a fair process. So Arundhati, you asked me to quickly say, where are we at? It is interesting. It is shocking to me that there has never been an international standard yet for menstrual products. We have them for screws, for paper clips, and not for this. So this process started, the conversations actually started in 2017, 2018. It was brought forward to the body, the ISO body. You had to have 2/3 of a vote to say yes, and 5 countries willing to bring their expertise. Luckily, 12 countries said, we want to bring our expertise. And in 2022, this work began. They're hoping it'll be finished in 2027. But as you can see, that's many years of working on this, which is why this becomes the industry standard, because everyone knows the rigor that went into this. And we know now that then companies can trust this, investors can trust it, governments can trust it. So the role that national standard bodies need to play is to be involved. A standard is only as good as people rely on it and use it. And so the national standard bodies play a key part in being a part of these conversations once this will be published, in enforcing it and asking manufacturers to use it, because it creates a common language now. Many, like as manufacturers, as we talk about the supply chain, one of the frustrating parts is you can pass one national standard, but you go to a different country and they speak a different language, and now you have to redo your product. And so this creates a global harmonization, which then makes it easier for the companies, because as the companies come in now, they have all the same rules. It levels the playing field. Everyone's on the same court, whether you're a big or small manufacturer or company, you now are playing by the same rules, which then that means there's going to be more competition. More companies will come in. Maybe those who've had barriers or things have been confusing, they didn't know where to get information. Now they know. And as Sonia so well articulated, healthy markets need competition. That drives supply, and people, manufacturers want their product to be bought. As that's bought, it drives prices down and brings innovation. So really, the ISO and the national standard bodies, they play an anchoring part in this market-based approach to set the standard. We all speak the same language. This is the requirements. And so then that can drive investment, bring further manufacturers to the table.
Great, thanks, Diana. And I think just, a fear that we've heard with standards is that does the setting of standards, whether at a national level or at a global level, prevent opportunities for smaller and local players? This is often a fear that comes up. And the second one is also the role of standards in enabling. There's so much of export of menstrual products and importing of menstrual products, and standards can also play a role there. So I think 2 questions that we can come back to you as well. So I want to encourage anyone to put in questions in the chat box for us. I'm going to go around Martin, Adrian, and Diana once again. I'm going to ask for your very quick reflections because we've just got 10 minutes and we do want to throw it open for some Q&A. I want to ask you all that how can the broader menstrual health community, which are small NGOs, CSOs, implementers, researchers, governments, as well as private sector actors, how do they begin to engage with this market-based approach? We know that it's not an entirely new concept, but it is a newer concept for us working in the MF space. So just give me one minute from each one of you. what is your call to the MH community? How can we learn more, engage more with this particular emerging area of work? Martin, over to you.
Thanks, great question, Arundhati. You'd probably be not surprised to hear me say that we need to get more voices into our menstrual health supplies workstream, into these conversations, so that we do have all of those points across the value chain, as you've heard from Sonia and others. That's certainly one. Each stakeholder group has a key part to play, I think, in their particular market functions, and this requires a real focus on that enabling environment, on innovation around product and product process and products themselves, and a willingness to really pivot to adapt to meet the needs of end users. And that collective action, that concept that no single organization can do this alone, is at the heart of our HSC. It requires collaboration. It requires coming together. It sometimes requires leaving our egos and our logos at the door, working for the greater good, elevating these issues which need to be focused upon, ISO being a great example that Diana was speaking about, and then being very creative in responding to them. So I'll answer that on your question. I can come back in on the climate question you posed earlier, but I'll hand back to you for now, Arundhati. Thanks.
Thanks, Martin. Love the emphasis on collective action. Adrian, over to you.
Thanks, Arundhati. And yeah, let me start by echoing what Martin is saying. I think the MH supplies workstream is really a space where a lot of these conversations are taking place. So please do join it. The team has, or the group has, an incredible work plan where a lot of exciting things are happening throughout the year. So definitely join the group. I've broken it down into a couple of groups. For all the people who are working with NGOs, INGOs, technical experts, you have so much experience working with governments, advocacy and policy. Apply that to the market lens. At the national level, engage your national standards bodies. Are they already in the ISO technical committee? If not, go encourage them, have that engagement. It's key. Try to push on taxes. Again, RHSC's workstream is working on an assessment of the tax pressures on menstrual products across the value chain, but we need you to put pressure on your governments to look at where are the structural barriers and what needs to change. And I would say put pressure on government programs. We need to continue with subsidized access for specific populations, but free distribution is not the best way. It doesn't provide choice. There are challenges around quality and centralized procurement from time to time, but we can use subsidized access if it goes through vouchers and or digital digital wallets to, instead of disturbing the local market, it can create a pool where we work with local retailers to make a range of menstrual products available. There's an opportunity there. If you're producing products yourself in whatever program, again, keep doing the work that you're doing. If you're handing out products, keep doing that, but make sure that the products are of quality, work on standards. There's growing body of literature that's coming out right now on the contamination of menstrual products. It's not rocket science, but there's science in making menstrual product. And if you haven't never thought about it, just think about what is the dye in the fabric that you're using. Because if it's the wrong dye, it will be very harmful for the user. So we need quality, we need choice. And again, if you're providing products for free, try to subsidize it and offer choice. There's a huge opportunity there. And for the private sector, engage in the key policy topics that define your industry, standards, taxes. This is your opportunity because, as Diana said, the ISO standards are going to be industry benchmarks. So now is the time to add your voice. And again, RHSC is a great platform to start with that. National standards bodies is a second one. Build your own organizational capacity. Learn how to sell to an end user. It's a different skill, but it's an incredibly important one, because if you learn to do that, how to sell and how to create demand, you will become the household brand of the future, and you can learn from other industries. I think a key one in terms of building stronger businesses, diversify your product portfolio. The successful companies that I see, they don't stick to a single menstrual product. They sell a variety of menstrual products or femcare products even. And then finally, be open to work with value chain partners. You don't have to do everything yourself. If you are a brand, you can work with a manufacturer. If you are a manufacturer, you can white label, work with trusted retailers. But if you want to do everything in the value chain, it becomes incredibly difficult to be successful. Let me stop there.
Thanks, Adrian. You've actually got me thinking that we probably need to figure out a series of webinars for SMEs to get into this a bit more. Thanks for sparking that thought. Diana, over to you to, your closing thoughts. How can we engage more?
Yeah, I'm going to stick with the standards because I feel like that's a low-hanging fruit right now. We're in the development phase. So all of you could go to your national standards bodies and find out, is your country involved? Do they have seats at this table? See if they can get involved in the ISO TC 338. And then also begin the advocacy work, letting people know this is coming. We want to have this be the standard for our country. And so start the advocacy work. See if you're involved. If not, get your government and other key, your self-manufacturers, your national, Bureau of Standards involved, and then advocate for it so that when it is published, it will become the standard by which everyone will use it in the industry.
Thanks, Diana. And also in the chat box, I think Sarah's put a link to the RHSC. There's a web page that's got standards by countries, and that's going to be updated in the next 6 to 8 months. So keep an eye, I think over the next year. So keep an eye on that. But if you want to know more about how to engage with your NSPs, do reach out to Diana, Tanya, who's not here today, also to Sarah. I think the RHSC MH workstream can provide you with inputs on that. I know we just have a couple of minutes left, but just do want to circle back to some of the questions that have come out. I think the one on how do we adopt ISO, that's kind of answered. But Adrian, I think coming back to you, do you have an example of a country that has done well in terms of building MH markets? And do you have an example of a LMIC country? And then Martin, I do want to last circle back to you on the resilient MH markets.
Yeah, of course. Happy to do that. And look, I could look at a high-income country, and I think it's important to do this from time to time because we always push reusable products as an opportunity. But in a context where most people don't think about money, if you take a country like Australia, 25% of the under 30-year-olds are using reusable menstrual products. Why? Because they want to. They enjoy them. They work well for them. Maybe there's environmental reasons, maybe there's health reasons. There's enough drivers to use it without money being in the picture. And product categories are being established in different countries, but their markets are at different stages, right? In Nigeria, it is not possible to import reusable pads because there are no standards. In East Africa, countries like Kenya have reusable pad standards, and Uganda also has menstrual cup standards. So they've taken another step, right? Certain countries have lowered the VAT across the menstrual product spectrum. They've taken another step. These are all building blocks in that process. But in terms of like showing you the opportunity, this is not theoretical. I've just come back from 10 days in India, and we're talking about a population of 1.4 billion people where 800 million people still rely on food stamps, right? So there is a huge gap in accessing essential products. But what we're seeing at the same time, and this is something we need to accept, with a market-based approach, we need to start with availability of the product for anyone. Because if you are a lawyer and a partner in a law firm working in Delhi, Nairobi, Kinshasa, Lagos, you have as much choice as the cleaning lady who cleans your apartment and lives in an informal settlement 5 kilometers away. You can both buy a single-use pad. You don't have the wide choice. But in India, that's shifting. We now see a wide range of reusable products being made available by companies, not just in the big cities, tier 1, tier 2, tier 3. They're leveraging online sales, but also offline sales. And I'm not talking about a few products here or there. There are companies that have sold more than 8 million menstrual cups, making tens of millions of dollars in revenue. And of course, there's still a drop in a bucket in India, but they are scaling in a rapid fire pace. So these companies have figured out how to build a model that can make menstrual products available. And while they started with the highest income group, we are seeing them dropping rapidly further and further down the income level. And if this is the pyramid of people today, then this top part has access. This bottom part needs subsidy, but this middle, we cannot forget the middle. That's the bulk of the people. And we see this happening in India. And I think it's going to be a question of a few years before we're seeing the same thing happening in different economies across sub-Saharan Africa. So look to India, look at companies like Sirona, PSafe, and others that are doing phenomenal jobs. Look at companies like Mahina. Here in East Africa, we have great examples from companies like Kasha and Wasoko that are retail and wholesale partners that are pushing the envelope. And I think it's going to happen very, very quickly. This is the opportunity right now. So there are plenty of examples, and countries are at different stages.
Thanks, Adrian. Martin, over to you. And then we'll close in just about 5 minutes.
Yeah, thanks so much, Couldn't agree more, Adrian. So you know, in terms of climate resilience, we definitely need to take a sort of a two-pronged or a two-faceted approach here. We're looking both at the impact that menstrual health supplies and supply chains have on climate, but also the risk that climate disruptions do pose to product access. And at RHSC, we're looking at that across our different RH areas. But at the center of the discussion, in my opinion, needs to be choice. So many users certainly want eco-friendly products, and not just in the higher income markets. There's a very good example of Australia that Adrian was giving us. But in many markets, those eco-friendly products tend to be cost prohibitive up front in terms of the cost that's needed for that reusable product potentially, even if they're more efficient long term. And those options still remain limited in many markets and don't yet meet the requirements, the needs of those who menstruate. And market-based approaches are the answer. They're the solution. They'll drive innovation. They'll help to reduce costs. They will push for markets and products that better meet those needs. But we do need to keep this climate resilience. We do need to keep these issues in mind. And this, I think, will be a very, very hot topic and a very clear focus of discussion in our community generally and in the menstrual health supplies work stream of RHSC specifically. So back to you, Arundhati.
Thank you, Martin, Adrian, and Diana for joining us and providing us that quick snapshot as to where these opportunities are and what's the need. Thanks so much for that. Thanks everyone for joining us today for this. Just want to call your attention in the chat box. We've got links to reports, the RHSC database for menstrual product standards. There's a great webinar series that Sarah and others have been pulling together since last year that gives more concrete examples of market-based approaches. And of course, there's the fantastic work that's happening at ISO. And in fact, a bunch of meetings that are happening next week, including bringing NSPs working across LMICs together. So there are fantastic opportunities to engage. The people that you see on your screen are the ones to engage with, as well as Sarah, who's behind the scenes, but she's there. So please do reach out to us if you want to know more, if you want to explore opportunities for engagement. We will be sending out the recording as well as resources, and hopefully a fantastic new resource by the RHSC MH workstream on the theory of change for a market-based approach. So please look out for those fantastic resources. Sarah, is there anything that you want to add before we close the webinar today?
Thanks, Arundhati. Yeah, I think I would just echo my thanks for all of our excellent panelists, as well as to all of you who have joined today. I think there's some very excellent questions and conversations unfolding in the chat. And as Arundhati said, we welcome anyone who's interested in joining the menstrual health supplies workstream. We also look forward to continued collaboration with GMC around this topic. Yeah, a huge thank you to everybody for joining, and be in touch if you have any follow-up questions. Thank you all so much.
Great. Thanks, everyone. Have a great rest of your day. Thanks, everyone. Bye-bye.
Thanks so much, everybody.
Thank you, Arundhati, for moderating. You did a great job. Thanks so much.
Yeah, thanks, Arundhati.
Thank you.